All right, so it looks like someone's prepping for an orthoptist interview,
Oh, wow.
which is super exciting.
Yeah.
And they've been doing their research.
Good for them.
They've got all this material from RoleCatcher,
Oh, nice.
career guides, interview guides, even info on like how AI can help you tailor your responses.
That sounds really useful.
So are we ready to just dive into like what really matters to like ace this interview?
Absolutely. I think one of the most interesting things that the RoleCatcher material highlights is how important it is to really have a solid understanding of what orthoptists actually do,
Okay.
on a day-to-day basis.
Not just book knowledge.
Not just knowing the science, but really being able to connect with people and understand their needs and help them see the world more clearly.
So like before we get into the nitty gritty of the actual interview questions,
Yeah.
let's paint a picture of like a day in the life.
Okay.
So what are some of the things that orthoptists actually diagnose and treat?
Sure.
I see strabismus and amblyopia are mentioned a lot in these guides.
Yeah. Those are two of the most common conditions that orthoptists encounter.
Okay.
Strabismus is basically when the eyes don't align properly, so they might cross or wander.
Got it.
And then amblyopia, which is often called lazy eye, is when the vision in one eye doesn't develop fully, even with corrective lenses.
Interesting.
And both of these conditions can really impact a person's quality of life,
Especially for kids.
especially for children. Yeah.
So when an interviewer asks you,
Yeah.
can you describe your experience working with pediatric patients?
Right.
It's not enough to just be like, oh yeah, I've worked with kids before.
Exactly. You really need to go deeper and show that you understand the specific challenges and rewards of working with young patients.
So it's like,
So, for example, do you use specific techniques to make children feel comfortable during exams,
like games.
like games or storytelling?
Oh, that's a good one.
Or have you received any specialized training in child development
Yeah,
or pediatric orthoptics?
that makes a lot of sense.
Those are the things that will set you apart.
And this is where I feel like RoleCatcher's AI could really come in handy.
Oh, absolutely.
Because it can analyze the job description and be like, hey, these are the skills you should be highlighting.
Exactly. It's like having a virtual coach who knows exactly what this employer is looking for.
That's pretty cool.
And they can even help you rephrase your answers
Oh, wow.
to sound more confident and polished.
Okay, so we've talked about kids.
Yes.
What about another question they love to ask?
Yeah.
How do you stay current with advancements in orthoptics?
Right. And you don't want to just give a quick answer like, oh, I read articles.
No, they want more.
They want to see that you're genuinely committed to lifelong learning.
So
So think about specific journals you follow, or conferences, or professional organizations.
what are some examples?
Well, like the American Orthoptic Journal or the annual meeting of the American Association of Certified Orthoptists would be good ones to mention.
Those are good ones.
Yeah,
Could you even say like, oh, there's this new development that I'm really excited about?
absolutely. That's a great way to show that you're not just passively staying informed, but that you're actively engaged with the evolving landscape of your field.
So what could be an example of that?
Well, maybe there's a new treatment approach for amblyopia,
Yeah.
or a groundbreaking study on the genetic factors influencing strabismus.
Interesting.
Sharing those insights shows genuine enthusiasm.
All right, let's get real for a second.
Sure.
Can you describe a time when you had to work under pressure to meet a deadline?
Yeah.
I feel like that's in every interview.
It is a classic.
But what are they really getting at with that?
Well, beyond just wanting to hear about a stressful story, they're really assessing your organizational skills,
Okay.
your ability to prioritize tasks,
Right.
and how you handle pressure.
So like,
Can you stay calm and focused when things get hectic?
so how do you approach that question?
Well, it's more than just telling a story.
Yeah.
It's about highlighting the skills that they're looking for.
Give me an example.
So, for example, maybe you had to juggle multiple patient appointments or prepare a complex report on a tight deadline.
Yeah.
Or troubleshoot a technical issue while still providing excellent patient care.
And I bet they love hearing about the outcome too.
Oh, absolutely.
Like not only did you handle the pressure, but you had a positive result.
Exactly. Did you meet the deadline successfully?
Yeah.
Did you implement a new system that streamlined your workflow?
Right.
Did you receive positive feedback from your supervisor or colleagues?
Cool.
Those details show that you're effective even under pressure.
Right. Confidentiality is huge
Yeah.
in healthcare.
Absolutely.
So how do you tackle this question?
Okay.
How do you ensure patient confidentiality?
Right.
It seems pretty straightforward, but I feel like there's more to it
Yeah.
than just saying, oh yeah, I follow HIPAA.
While stating that you understand and adhere to HIPAA regulations is essential,
Yes.
They're also looking for a deeper understanding of the ethical considerations involved. So talk about specific protocols you follow in your daily work.
Okay.
Do you have systems in place for securing patient files, both physical and electronic?
Interesting.
Are you mindful of conversations in public areas?
Oh, yeah.
Ensuring you're not inadvertently disclosing sensitive information?
Right.
Do you emphasize the importance of patient privacy with your colleagues and staff?
Okay.
Those details show that you're not just following rules, you're actively cultivating a culture of confidentiality.
What about like those tricky follow-up questions?
Oh, yeah.
Like, have you ever encountered a potential confidentiality breach and how did you handle it?
That's a great point. It's good to have a specific example in mind
Okay.
that demonstrates your ethical decision-making and problem-solving skills.
So what could be an example?
Well, did you notice a colleague discussing a patient's case in an inappropriate setting?
Okay.
Or did you have to address a situation where a patient's information was accidentally misplaced?
Interesting.
Sharing how you navigated that challenge really showcases your commitment to patient privacy.
Okay, this next question seems to pop up a lot in the RoleCatcher guides.
Okay,
Can you describe your experience working with patients with low vision?
right.
So what kind of insights would really impress an interviewer here?
Well, it's all about showcasing your specialized knowledge and empathy.
Okay.
They want to know that you can go beyond just basic vision assessments and that you understand the unique needs of this patient population.
Give me some examples.
Sure, talk about your experience with different low vision aids and technologies.
Oh, like,
Are you familiar with magnifiers or telescopes or text-to-speech software?
got it.
Have you worked with patients who use guide dogs or other mobility aids?
Okay.
And perhaps most importantly, can you demonstrate your ability to adapt your communication style
Okay.
and provide sensitive, compassionate care to individuals facing significant visual challenges?
It's interesting how each of these questions is really like revealing what employers value
Yes.
in an orthoptist.
Yeah.
It's like this blend of technical expertise,
Yeah.
communication skills, and a genuine passion for helping people.
Exactly. And speaking of passion, the next question on RoleCatcher's list is a great opportunity to showcase yours.
Okay, what is it?
They often ask, can you describe your experience working with patients with strabismus?
Oh, interesting.
And this is where you can really dive into the specifics of this condition and how you approach diagnosis and treatment.
So what kind of details would you suggest focusing on?
Well, think about the different assessment techniques you use, like cover tests or Hirschberg testing.
Okay.
Are you familiar with the latest advancements in strabismus surgery or non-surgical treatment options like vision therapy?
Yeah.
And you could even share a specific example of a patient you helped achieve successful outcomes.
So it sounds like they want more than just like textbook knowledge.
Absolutely.
They want to know how you apply it.
Exactly. They want to see how you apply your expertise in real-world situations.
And that's what makes these interview questions so valuable. It's not just what you know, it's how you use it.
Exactly. It gives you a platform to demonstrate not just what you know,
Right.
but how you use that knowledge to make a positive impact on the lives of your patients.
Okay. We've covered some heavy-hitting questions.
Well, we have.
But this next one really gets to the heart of patient interaction.
Okay.
So RoleCatcher highlights this question. Can you discuss a time when you had to communicate difficult information to a patient or family member?
Ooh, that one can be challenging.
I bet.
But it's also an incredible opportunity to showcase your emotional intelligence
Right.
and your ability to build trust with patients, even in difficult moments.
So how do you even approach that question?
Well, it's crucial to choose an example that demonstrates specific communication skills like empathy,
Yeah.
active listening, and clear explanation.
So like what kind of example would you use?
Well, maybe you had to explain a complex diagnosis to a parent whose child was just diagnosed with amblyopia. Or perhaps you had to discuss the risks and benefits of different treatment options with a patient considering strabismus surgery.
Got it.
And of course, you want to talk about the outcome.
Yeah.
How you navigated that difficult conversation and provided support to the patient and their family.
So did you make sure they understood?
Exactly. Did you take steps to ensure they understood the information fully?
Right.
Did you provide resources or connect them with support groups?
Okay.
Sharing those details demonstrates your commitment to patient-centered care, even when delivering challenging news.
And we know RoleCatcher's AI can help here too.
Oh, absolutely. Their platform can analyze your answer
Oh, wow.
and provide feedback that's specific to the orthoptist role.
So it's like tailored.
Exactly, suggesting ways to refine your language and highlight the skills that are most relevant to this particular employer.
That's amazing.
It is.
Okay, let's move on to another condition-specific question
Sure.
that RoleCatcher says comes up a lot.
Okay.
Can you describe your experience working with patients who have amblyopia?
Right. This is your chance to really showcase your in-depth knowledge of amblyopia and its various treatment options.
So, like, what are the things that they're looking for?
Well, do you have experience with patching therapy or atropine eye drops or vision therapy?
Interesting.
Have you worked with patients of different ages? Because treatment approaches can vary depending on the developmental stage of the child.
That makes sense.
It does.
They're looking for someone who can really tailor it.
Exactly.
Yeah.
Tailoring treatment plans to each individual patient's needs is really what makes orthoptics such a rewarding field.
I bet.
You know, you're not just applying a one-size-fits-all approach.
Right.
You're using your expertise to create personalized solutions that can truly improve a person's vision and quality of life.
All right, teamwork is essential
Absolutely.
in any healthcare setting.
Yes.
So let's unpack this question.
Okay.
Can you describe a time when you had to work collaboratively with other healthcare professionals?
Right.
What would be a good example to highlight here?
Choose a situation that highlights your communication skills,
Okay.
your ability to coordinate care effectively, and your respect for the expertise of other professionals.
So, for example,
Maybe you worked with an ophthalmologist to develop a treatment plan for a patient with complex strabismus. Or maybe you collaborated with the pediatrician to address a child's developmental delays that were related to their vision.
Interesting.
Yeah, it's all about being a valuable member of the healthcare team.
Right. And I bet they also ask those follow-up questions
You do.
about any challenges you faced working in a team and how you overcame them.
Exactly.
So it's not just about the successes.
Right. It's about demonstrating your ability to learn and grow from those experiences.
All right, let's wrap up this first part of our deep dive with one final question
Okay.
that often comes up in orthoptist interviews.
Yeah.
How do you prioritize your workload when you have multiple patients to see?
Oh, that's a good one.
It seems like a simple time management question, but I bet there's more to it.
It's about showcasing your organizational skills,
Okay.
your ability to make sound judgments,
Right.
and your commitment to providing timely and effective care to all your patients.
So what are some details that would impress an interviewer?
Well, outline your process for triaging patients,
Okay.
assessing the urgency of their needs,
Right.
and scheduling appointments accordingly.
Like, is there a system you use?
Yeah. Do you use a specific system for tracking patient information and ensuring follow-up care?
Gotcha.
Have you developed strategies for managing your time effectively, like delegating tasks
Okay.
or using technology to streamline your workflow?
So they want to see that you're proactive.
Exactly. A proactive approach to managing a busy caseload rather than just reacting to whatever comes up.
And I bet they ask about those follow-up questions too.
They might, like, how do you handle emergencies?
Oh, yeah.
Or unexpected disruptions in your schedule?
Or if you're short-staffed.
Exactly. It's all about demonstrating your ability to adapt and stay organized even when things get hectic.
Which I imagine is a lot in that field.
It can be, but it's also incredibly rewarding.
And that's something that any employer would value.
Absolutely, in a healthcare professional, especially in a fast-paced field like orthoptics.
For sure.
Yeah. It's fascinating how these interview questions really go beyond just like testing your knowledge.
Yeah.
They're really designed to uncover your thought process, your problem-solving abilities, how you approach patient care, in a dynamic environment.
It's like they want to see what it would be like to work with you.
Exactly. And speaking of working alongside others,
Okay.
RoleCatcher's Career Guide really emphasizes the importance of teamwork and collaboration in orthoptics.
That makes sense.
And they often ask a question like, can you describe your experience using specific equipment or techniques in orthoptics?
So this is where you showcase that technical expertise.
Exactly. And your ability to work effectively as part of a team.
So it's not just like rattling off a list of equipment.
No, it's about demonstrating how you apply that knowledge in a collaborative setting.
Give me some examples.
Sure. So think about times when you've worked closely with other professionals.
Okay.
Maybe an ophthalmologist or a fellow orthoptist to diagnose and treat a patient.
Got it.
Did you use a visual field analyzer to assess a patient's peripheral vision?
Okay.
Did you collaborate with a colleague to administer a complex series of eye movement tests?
Interesting.
Or maybe you had to troubleshoot a technical issue with a piece of equipment while you were working with a patient.
So it's like you can not only use the equipment, you can also problem solve and communicate.
Exactly. Communicate, effectively problem solve, worked seamlessly with others.
And I bet they love those follow-up questions too.
They do.
Yeah.
They might even ask about specific challenges you've encountered while using certain equipment or techniques and how you overcame them.
So you got to be adaptable.
You do. Adaptability, resourcefulness in a clinical setting are key.
All right, let's talk about a question that could really throw someone off.
Okay.
RoleCatcher highlights this one. How do you handle a disagreement with a colleague or supervisor about a patient's treatment?
Ooh, that's a tough one.
Right. It's not something you usually prep for.
No, but it's incredibly important. They're assessing your professionalism,
Yeah.
your conflict resolution skills,
Yeah.
your ability to advocate for your patients while maintaining respectful communication.
So what's the right way to approach that?
Well, it's crucial to be honest and authentic, but also demonstrate your ability to handle difficult situations maturely.
It's like, how do you do that?
Choose an example that highlights your commitment to ethical practice, your respect for different perspectives, and your ability to find common ground.
Okay, what would be a good example?
So maybe you had a different opinion about the best treatment approach for a patient with amblyopia,
Okay.
and you had to respectfully present your reasoning to your supervisor.
Yeah, that's tough.
It is. Or maybe you observed a colleague using a technique that you felt was outdated or potentially harmful, and you had to address that situation diplomatically.
Oh, wow.
And of course, they want to hear about the outcome.
Yeah. How did it go?
Did you listen carefully to the other person's perspective? Did you present evidence-based research to support your view?
Good point.
Did you ultimately come to a consensus that everyone felt comfortable with?
That everyone could agree on.
Exactly. These details show that you can navigate challenging interpersonal dynamics effectively.
Right. Staying organized, managing a complex caseload.
Oh, it's essential,
So important.
especially in orthoptics.
So RoleCatcher mentions this question a lot. Can you describe a time when you had to manage a complex caseload or prioritize multiple tasks?
Right.
Pretty straightforward, but I feel like they're looking for something specific.
They're assessing your ability to think critically,
Okay.
make sound judgments, and stay focused under pressure.
So it's like a step beyond just being organized.
It is, can you juggle multiple patients' paperwork deadlines without compromising the quality of care?
So how do you answer that?
It's more than just telling a story about a crazy day. It's about highlighting the specific skills and strategies you use to manage your workload effectively.
Give me an example.
Okay, so choose an example that demonstrates your ability to prioritize tasks, delegate appropriately, and utilize technology or other resources to streamline your workflow.
I like that.
Yeah, make it practical.
What are some details that would really stand out?
Well, did you implement a color-coded system for tracking patient appointments?
Oh, that's clever.
Did you develop a template for documenting patient assessments that saved you time?
Oh, that's a good one.
Or perhaps you collaborated with colleagues to create a shared calendar to help everyone stay on top of deadlines.
That's a good idea.
It's about being proactive and finding creative solutions.
I bet they have follow-ups for this one too.
Oh, they might ask about how you handle unexpected emergencies, or how you prioritize tasks when you're short-staffed, or how you deal with a backlog of patients.
So it's about showing you can handle the chaos.
Exactly. Adapt and stay organized even when things get chaotic.
A very important skill.
Absolutely. A quality any employer would value.
Okay, let's switch gears a little bit and talk about a question that's more about like your personal approach
Right.
to orthoptics.
Yeah.
RoleCatcher highlights, what are your strengths and weaknesses as an orthoptist?
Oh, that's a classic.
Right. It can be kind of tricky.
It can be, but it's a great opportunity to showcase your self-awareness and your commitment to continuous improvement.
So what's the key here?
Be honest and authentic, but demonstrate your understanding of what it takes to be an orthoptist.
Okay.
Choose strengths that are relevant to the job description.
Like what?
Communication skills, technical expertise, your ability to build rapport with patients, your dedication to compassionate care.
What about weaknesses?
Acknowledge areas where you have room to grow, but frame them positively.
Okay, so like
Choose a weakness that you're actively working to improve.
what could be an example?
Maybe time management or public speaking or staying up to date on the latest research.
Okay. And how do you show you're improving?
Maybe you've enrolled in a time management course, joined a public speaking group, or subscribed to some professional journals.
to stay current.
Exactly. It's all about showing that you're self-aware, proactive, and committed to continuous learning.
All right, let's tackle a question that often comes up early on.
Okay.
Why did you choose to become an orthoptist?
Right. They want to hear more than just a generic answer.
Yeah, what are they getting at?
They're looking for your genuine passion for the field, your understanding of the role, and what drives you to help others.
So how do you answer authentically?
Think about what sparked your interest in orthoptics in the first place.
Okay.
Was it a personal experience, a mentor who inspired you, or just a fascination with the science of vision?
So tell me your story.
Exactly. Share your story authentically, highlighting what resonates with you.
What would be some good examples?
Maybe you witnessed the impact of orthoptics on a family member who struggled with vision problems.
Yeah.
Maybe you were drawn to the collaborative nature of the field, or maybe you're passionate about research.
Okay.
It's about conveying genuine enthusiasm.
And remember, RoleCatcher's AI can help here too.
Oh, absolutely. Their tools can help tailor your answers.
That's awesome.
Their platform can analyze your responses, provide feedback, suggest ways to refine your language, highlight the skills that are most relevant.
It's like having a coach in your pocket.
It really is. And by using these tools and preparing thoughtfully, you can approach your interview with confidence and showcase your unique strengths.
That's a great point.
You know, we've covered so much,
Yeah.
like those tough questions and how to show off your skills.
Right.
But there's one thing RoleCatcher really stresses in their interview guide:
What's that?
asking good questions.
Oh, yeah.
It's not just about answering theirs.
Right, you got to show interest.
Exactly. You want a real conversation.
Makes sense.
Show you're interested in the role and the whole organization.
So what kind of questions should people prepare?
Well, instead of just the generic, do you have any questions for me?
Yeah.
Think about things that show, the field
Okay.
and that you're really curious.
Like what?
You could ask about their approach to patient care,
Right.
or the types of cases you might see,
Makes sense.
or opportunities for professional development.
Continuing education.
Exactly. Maybe ask about their technology
Oh, that's a good one.
or any research they're doing.
Shows you've done your homework.
Right? And you're thinking ahead.
You could even ask about their experience working there.
Oh, that's a great idea.
What do they like best?
Yeah, what challenges have they faced?
Shows you really want to be part of the team.
Exactly.
And RoleCatcher's AI can even help with the questions.
It can.
That's so cool.
You can input the job description,
Wow.
and it generates tailored questions
It's relevant.
to that specific role and the organization.
It's like having a secret weapon.
It is.
Okay, one last thing from RoleCatcher.
Okay.
Their career guide talks about networking.
Oh, that's huge.
It's not just what you know.
Right. It's who you know.
So conferences,
Yes.
professional organizations,
Like the American Association of Certified Orthoptists.
and even LinkedIn.
LinkedIn's great for connecting.
Yeah, it's all about building those relationships,
It's expanding your knowledge.
sharing what you know.
And you never know, you might find a mentor.
Oh, yeah. Or your next job.
Exactly.
So as you get ready for this interview,
Yeah,
remember, it's more than just getting a job.
it is.
It's about this amazing
and
career,
letting people see the world.
using your skills and your compassion,
And with all these resources from RoleCatcher,
and the power of AI.
you are ready to shine.
So go out there, be yourself, show them what you've got.
You got this.
We're rooting for you.